Today's Neurology Minute features topics from the latest issue of Continuum.
Hi, this is Jeff Ratliff with Neurology Minute. Today is the second part of our Continuum series with Jessica Ilani discussing acute migraine treatment. Jessica, what pitfalls do we need to avoid when planning an acute migraine treatment plan for our patients?
So I think there's 4 things that we really need to think about when planning acute treatment. The first is for us to realize that it's not one size fits all. We have to get this idea out of our mind that every patient with migraine is not the same. So we can't design the same exact treatment plan for every patient, and that every patient's attacks are not always going to be the same. So that patients might need different acute treatment options for different attacks. The second thing is that we need to start to consider not only using oral treatments. Sure, tablets are really easy to use. I like to use them. I'm sure you like to use them. No one really likes to stick something up their nose or give themselves an injection. But when you're having nausea or vomiting, or your attack onset is within minutes, you're going to need something that's not a tablet to be effective. And having that discussion early with patients can really make the difference between feeling better, throwing up your medication, ending up in the emergency room, or migraine freedom. The third point is to not provide a rescue plan can sometimes lead to a lot of problems. So if you have a patient who comes in for a visit and tells you that they've recently been to the emergency room or urgent care, or you've noticed that there's a patient who's been calling a lot because their acute treatment is not working, it's time to bring them in for a visit and discuss a rescue plan. What do you do when your acute treatment is not working? And the fourth and final thing is sometimes we forget to ask our patient, are you symptom free after you take the treatment that I gave you for your migraine attacks? I forget to do this, and I hate to say it because this is my specialty and I shouldn't, but sometimes we get rushed and we forget to ask that vital question. But I find that if we do, we'll identify patients that really could benefit from a change in acute treatment, and that simple change can mean all the difference for their quality of life.
Perfect. Thank you, Jessica. We'll be back tomorrow for another topic about acute migraine treatment from the latest Continuum on headache. This issue was guest edited by Matthew Robbins. This has been your Neurology Minute Daily Briefing. We'll see you tomorrow.